The single leg hip thrust. The single leg hip thrust is intended to strengthen the gluteal muscles. Lean with your upper back on a bench, legs bent and buttocks sinking down toward the floor. Raise one leg. While pushing the heel into the floor, raise the pelvis upward until the body is straight, and then return to the starting position. Be sure not to arch the back during any stage of the movement. This exercise focuses the load on the glutes. The main movement is hip extension. The hamstrings are in active insufficiency, and most of the load is on the gluteus maximus. It is important to keep the back straight throughout the movement. Lifting the leg from the floor increases the load on the active leg and also activates many stabilizers, among them the hip internal rotators and the oblique abdominals, which prevent the body from rotating and collapsing. Raising one leg increases the level of difficulty in two ways. First, it intensifies the load on the gluteus maximus of the active leg. Second, it activates many stabilizers that prevent pelvic and spinal rotation, which would not have happened if both legs were on the floor. The gluteus maximus extends the hip joint. In addition to strengthening the gluteus maximus muscle, another aim of the exercise is to strengthen the core muscles and the hip stabilizers. The inferior part of the gluteus maximus exhibits high EMG signal amplitude during the unilateral bridge exercise. The inferior part is active primarily as a hip extensor, and the superior part is active as a hip extensor, abductor, and external rotator. Comparison of EMG activity of the superior and inferior portion of the gluteus maximus muscle during common therapeutic exercises, David M. Selkiwitz, 2017. Lifting one foot from the floor activates the hip internal rotators to stabilize the pelvis. If these muscles do not stabilize the pelvis, it will simply collapse. The hip internal rotators are the adductor longus, gluteus maximus, tensor fasciae latae, and anterior fibers of the gluteus medius. In addition to these muscles, the oblique abdominals also stabilize the pelvis and prevent its collapse. They are not shown in this animation. A characteristic mistake of hip instability. We can see the pelvis tilt as it is raised. This mistake is usually caused by weakness of the hip internal rotators, in light brown, or by lack of awareness.